Bismillah. The first category of cases, I'll start with Dr. Omega, pain, abdominal pain, usually pelvic pain. We start today gynecological emergencies. This is a middle-aged patient presented with pain, and the scan concentrated on the pelvis. What do you see, Abbas?
Okay, so this is a CT scan of the pelvis. I can see that there is an abnormality involving the left side of the pelvis in form of free fluid and cyst seen connected to the uterus. This cyst shows concentric walls with central hypodensity, denoting wall with edema. There is again large collection seen posterior to the uterus with
Show,
heterogeneous.
show me where is the collection.
Okay. This is abnormal collection with multiple
So
areas of
the
hyperdensity.
is the
Uh,
abnormality on the left side or the posterior?
and this is another abnormality. It's mainly posterior. And this
Oh,
structure is connected to the left side of the uterus.
mm.
So, yes, there is no free air.
The
Again,
patient
free
has
fluid seen.
acute severe pain, middle-aged female.
Okay. Okay, the uterus is not so much enlarged. However, still, I will be concerned about uh, ectopic pregnancy, if any history, ovarian torsion,
Any
and
history you want, any laboratory data?
yes, beta HCG level.
Negative.
Yes, history of amenorrhea.
Okay. Also negative. Normal menstruation 2 weeks ago.
Okay, any previous scan showing left ovarian cyst with torsion and hemorrhage bleeding into the pelvis?
So you are suspecting left ovarian torsion.
Yes, with bleeds.
Show me where is the suspected area of the torsion.
Okay, so
This
this one,
one.
yes, could
What
be the
about the
pedicle.
posterior located structure?
This
Okay.
could be a bleed
How
from
to
this
confirm? Because CT may be defective in gynecology. How to confirm? Any other additional study?
ultrasound and MRI would be of help.
Okay, I'll show you. Just give me the mouse.
Okay.
Okay, let's see this study first, and I will expand the screen. You can shift between T2 and contrast axial. Start with this one.
Okay, so this is T2 axial cuts. Okay, so
T2 fat
again,
set. Okay.
yes, again demonstrated large lesion posterior to the uterus with multiple peripherally located small cysts, likely representing follicles, and the structure is likely an enlarged ovary secondary to torsion. The
Which
okay,
ovary
yes,
is enlarged?
this is going to be the right one because I see the left
Okay,
ovary is yes, seems normal size, normal
good,
site. So
good.
this is acute ovarian torsion for the right side. This is
And even
surgical
you,
emergency.
good. In
Okay, so
my routine practice, I
yes, I
will.
will check the other. I will check the other sequences. I will check the other planes. I will urgently compare with previous
What preferred sequence you want to see next?
a contrast to check
Why?
for the vascularity.
Yes, viability. Okay, you can see the last one. Yes.
Yes, so yes, this is the contrast.
The axial is the one above this one. So it
Okay,
shows
it shows. Uh, yes, it shows decreased perfusion, decreased enhancement of this cystic structure. So this is ovarian torsion with pending ischemia. This is to be urgently referred to the gynecologist for urgent surgical management.
assuming I gave you ultrasound study, not just a minute, yeah, boss. I'll take the mouse. Yes. And I'll answer the case at the end. Ultrasound. Okay. Yes. Can you comment on ultrasound also? You can scroll.
Okay, So this is intravaginal or transvaginal ultrasound. It's not scrolling. It's a static
Okay,
initiation.
okay.
Okay.
I will
So yes.
refresh. I will refresh. No problem. Also with me. Okay. The image
Okay.
fixed on MRI. Okay.
Okay,
The
so yes,
main
this is
abnormality
there
here is
is yes, there
Hmm,
is a large soft tissue
yes,
echogenicity with multiple peripherally located hypoechoic cystic structures showing posterior costic enhancement. This is the ovary. The flow in the power Doppler scan is very diminished, actually almost absent. So this is suspicious for ovarian torsion with ischemia.
very good, very good. Let's revise one by one. Very good, Yabos. Very good, Yabos. It's an important case for practice and also for exam. Acute severe pelvic pain or intermittent pelvic pain, on and off. It's a classic for ovarian torsion in middle-aged female. But you are correct to rule out disturbed ectopic pregnancy or rupture ovarian cyst. It's very important to ask about menstrual history, any history of amenorrhea, and also laboratory data, beta HCG unit, positive or negative. If positive, it's a disturbed ectopic, definitely. If negative, maybe rupture ovarian cyst, maybe ovarian torsion, especially with intermittent or on and off. No constitutional symptoms. It's an important question also. No fever, no discharge, because we have another category we'll discuss today, inshallah, which is BID and postoperative complications. So we are in the first category, severe pain. Here, this is a broad ligament, and this is a normal, relatively normal left ovary with some follicles and this small cystic structure, maybe dominant follicle, it may be corpus luteum. So this is normal. But this structure, I don't know what is this. No, it contains small cysts. Small cyst at the periphery, it means displaced follicles at the periphery. This is a picture of ovarian torsion. And I cannot see the broad ligament well on the right side. Here, we can suspect some swirling movement. And if this is the ovary, it's enlarged. And number two, in abnormal location, posterior cul-de-sac. Abnormal location equals torsion. Reduce the enhancement as compared to the left ovary. I should suspect ovarian torsion from CT with some reactive fluid. Okay, from MRI, of course, MRI will be much easier. T2 is sensitive. The left ovary is normal in size, normal in intensity. But the right, you see here, my friend, what is this? Swirling. Okay,
Yes,
this is
radical.
yes, a swirling sign. It's torsed pedicle. Ovary number one, enlarged. It's ovarian edema. High signal in the stroma. Number two, abnormal location, posterior cul-de-sac. Posterior cul-de-sac, anterior to the uterus, superior to the uterus, midline location is definitely abnormal. But alhamdulillah, till now, the stroma mainly hyperintense. Hyperintense means edema. So when we give a contrast, it shows heterogeneous contrast, so still preserved vascularity as compared to the normal leftover. It's, of course, gynecological emergency. And the final one is the ultrasound. Again, enlarged stroma, central stroma devoid of follicles. Follicles are displaced to the periphery. But we see Doppler. Doppler is insensitive. Enlargement is a B mode ultrasound, grayscale ultrasound, very sensitive sign. Enlargement is the most sensitive sign. The second one will be abnormal location. And of course, you have to compare. Very good, yeah, boss. I'll give you another case. This one, I'll give you actually two cases to finish this category. You can scroll acute pelvic pain.
Okay, yes. So these are axial images. Yes, T2 for the pelvis with a patient presenting with acute abdominal pain. Again, the left, okay, there is large abnormal structure located on the posterior and left aspect of the uterus. It shows multiple internal cystic,
Which one? Which one?
okay, on the left, okay,
Yes.
هنا, on the left, okay,
On the left,
multiple
this is
follicles.
the normal side or may show some BCO appearance.
Yes, and
And
the right, and this is the right
this,
one,
yes, is
the
right
right
and
uterus. Yes.
superior to the uterus. You can expect its location from axial. It's superior to the uterus, not on one side. This is
Yes.
abnormal location. It's above the uterus.
Okay,
Anterior
so
or posterior or above. These abnormal locations.
again, I will be searching for the pedicles with swelling sign because it is highly suspicious for ovarian torsion. Maybe this one?
Okay, and I will
Yeah.
confirm on sagittal and coronal planes. Okay,
Yes.
sometimes the swirling sign may be apparent on one of the planes, not axial. Good. Uh, Early or late ovarian torsion?
Okay, this is T2 and the stroma is high, so likely edema.
Yes,
So this is early stage.
very good. Even, let's see, any other sequence you want to see?
Yes, the post contrast, please.
Okay, post contrast, and by the way, diffusion also can be sensitive. Post contrast, oh, what do you see
Okay.
here?
Okay, there is absence of enhancement. Lack of
Complete.
enhancement,
Mm.
yes, yes, yes. So this is likely late, very late.
No, no, alhamdulillah. Although, no contrast enhancement seen or scanty at the periphery. You see, scanty, but still the edema is good. T2, T2 showed edema. I'm sorry. Where? Yes. T2, it's massive edema, significant edema. No heterogeneity, no low signal intensity, no hemorrhagic infarctions yet. This ovary can be saved. Okay, it can be saved. Till now, it can be saved. No heterogeneity. And this is the normal enhancing
Left.
ovary, by the way. I'll show you another sign in the previous case. Normally, the follicles has no uh, okay, let's see this one. Ah, by the way, this ultrasound, alhamdulillah, appeared. Okay. This is ultrasound of the first case, my friends. Okay. This ovary is enlarged, containing vascularity. Enlargement is more sensitive. Okay. And the opposite one, normal in size. Comparison is very, 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 very important. Okay. On MRI, most of the follicles should have no low signal rim. If you see low signal rim, it's a hemorrhage. It's a starting hemorrhage. If surrounding all follicles, this is considered late sign. If low signal intensity inside, it's considered low يعني hemorrhage also, and this is late sign. Okay, so till now the first two cases yearly. What about this is the last case, my friend, acute ovarian or acute pelvic pain since 2 days.
Okay, so the uterus is unremarkable, abnormal structure, same posterior to the uterus. This is T2. This structure is hypo-intense on T2 with multiple patchy
Yes,
foci of hyperintensities, suggestive of hemorrhage. I would like
good,
to check this on the T1 to confirm the left ovary is normal. So this is
good.
suspicious for of torted right ovary, likely with ischemia.
Yes,
So I
and
would
in
like
my
to check
routine
the
practice,
post-contrast. Yes, and the
yes,
diffusion. Yes, so this is
post
the
contrast,
post-contrast. No, there is absence enhancement.
yes, as compared to the normal enhancing left ovary. Okay, almost always compare.
Okay.
Okay, very good, my friend. So T2 is sensitive, diffusion is sensitive, and also post contrast. But the edema pattern is a good, and heterogeneity or low signal on T2 is bad sign, especially if low signal around the follicles. Okay, excellent يا boss, excellent. Thank you, Dr. Anagam.
Thank you so much.
I'll take the control again. Okay. Okay, so the first category of cases, acute pelvic pain due to ovarian torsion. One friend said, Dr. Ismail, maybe fibroma. Okay, fibroma, yes, diffuse low signal T1, T2, but it replaced the ovary. Here, ovary still, the stroma is still present. We have also some follicles. And remember, acute pelvic pain. So this is a hemorrhagic infarction involving the ovary, not a low signal mass. Okay. Yes, some chronicity can be seen with scanty enhancement. Yes, but it can be saved. With preserved enhancement, it can be saved. With massive edema, it can be saved. Okay, next candidate يا boss.
Assalamu alaikum, sir.
عليكم السلام ورحمة الله وبركاته. How are you, my friend?
I'm good. How are you, sir?
Okay, الحمد لله رب العالمين. Can you ask for control?
Yes, sir.
I'll give you 2 cases.
Yes, sir, I requested.
I approved. Okay. Bill,
Thank you.
acute pain.
Acute pain. So I'm presented with the
Scroll.
axial MRI T2 weighted of
Okay.
the pelvis of a patient who is presented with
Middle-aged female.
middle-aged female presented with pain. Okay, I will just scroll down the images to get an idea, and then I will scroll back, and this is bladder. Yeah, there is a large cystic lesion in the mid of the pelvis, which is showing a significantly hyper intense signal with peripheral rim of low signal intensity. I can also appreciate a high signal fluid surrounding this lesion as well. I just tried to locate the.
What is the nature of this structure?
It is cystic appearing. High
Ovarian
high
cyst.
signal.
You mean
Yeah.
ovarian cyst? Okay. What about the ovarian stroma, the residual ovarian stroma?
Yes, I'm trying to look at. I mean, it's whole hyper intense cystic in nature with uh, peripheral areas, not well formed follicles seen in this location, and I can't even
Yes,
appreciate
we
any
see some
stroma.
follicles at the periphery. Good.
Yeah.
But the stroma is normal.
No, it is a high signal,
Good.
so it's
As
edematous.
compared. You can compare with the other ovary or other sequences. I'll give you
Yeah.
T1. Okay.
Yes. Okay. Okay, this is T1 of the same patient. Axial sections here, the same structure is appearing hypo-intense, hyper to the surrounding muscles as well.
Yes.
And the peripheral
Peripheral and posterior. Yes, peripheral and posterior, some high signal.
so just a minute, it's not scrolling.
Yes. You see the high
there
signal
are
posterior?
high signal posterior,
Yes.
yes.
Which may represent what?
This could represent a I
High
think
signal on T1.
cervix.
No. Let me help.
Okay.
This area posterior to the cyst. High signal on T1.
It could represent a hemorrhage
Yes,
in the peripheral
in the
part
setting.
of the ovary.
Okay.
Yes.
What's the next sequence you want to see?
Post contrast.
Okay. You can scroll and tell me your opinion and next step.
Okay, so on this post contrast, the large structure is still not showing any significant enhancement. However, I can see peripheral rim of enhancement.
Yes.
And this this is a fat set T1 post contrast.
Mhm.
So the signal is showing low signal intensity. Uh, it was high on T2,
So
low
what
on
is your
T1,
diagnosis and
low on
management?
T1. In a middle-aged female with acute pain, this could represent a um,
Simple, my friend.
hemorrhagic
Yes,
torsion. I mean
yes, 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 yes.
delayed chronic torsion with
Is it,
hemorrhage,
is it,
peripheral
no,
hemorrhage.
not chronic torsion, not chronic, it's acute. Is it normally located ovary?
No, it's not abnormal. It's abnormal. It's located in the
Yes,
midline. Yes,
yes, midline and
posterior
also
location,
somewhat superior. I will confirm
and
by other planes.
sagittal views, and
For
yes,
example, sagittal plane. And of course,
yeah,
it's a gynecological emergency. You see this area, it's a hemorrhage. Okay.
yeah,
This area is a
yes.
hemorrhagic component confirmed by T1. And we have two important signs here of ovarian torsion. According to RSNA, usually if we have a large cyst or a large mass, the
Mm.
ovarian stroma should be compressed and thinned out. It is not accepted to see a huge cyst like this and significant amount of residual stroma. No, stroma should be very thin. But what happened here? It's ovarian stromal edema. Edema in the presence of mass or cyst in the ovary, a good sign, a reliable sign of ovarian torsion. You see, this is
So
an
could
edematous
it be
stroma.
endometriotic or hemorrhagic cyst within the ovary? That is
No,
stored.
no, no, no.
No?
Correlate, yes. Low. It's a fluid. Okay. This
Yeah.
is functional cyst. It's functional cyst. Low T1, high T2. Low T1, high T2. And this is just the
Okay.
hemorrhagic component due to,
Hemorrhagic component.
yes. But this is a functional cyst. Okay. Rapid
Okay.
enlargement causing torsion of the ovary. So abnormal location and again ovarian edema. Ovarian edema is the most sensitive sign if the ovary doesn't contain any mass. Another sign, which is abnormal location, also important, but still can be saved. We have some heterogeneous enhancement, so still can be saved. And no heterogeneity in the residual stroma. So in case of ovary containing mass or cyst, look for any edema and location. Okay.
Okay.
Another one. This is a classic exam case, especially for long reporting. Acute pelvic pain, middle-aged
Hmm.
female.
Okay, so this is again T2 axial image of a middle-aged patient presented with acute pelvic pain. This is T2 weighted image. I can appreciate well-defined lesion in the midline and the pelvis, which is showing a somewhat heterogeneous signal. The superior anterior component is showing high signal, and the posterior larger component showing somewhat intermediate signal intensity, with the small
With some
focus
layering.
of
You see
layering,
some layering, fluid level.
layering.
Good.
Yeah, fluid level,
And
and also I can appreciate some low signal
good.
uh, areas in the periphery as well. Uh,
What is the nature of this structure in the female pelvis?
it is some lobulated, kind of showing a small extension on the right side, maybe somewhat bilobulated. It is showing multiple inner structures with different signal intensities.
Okay, if you didn't
Yeah.
determine its nature, no problem. Go for the normal anatomy. This is the uterus. This is the right ovary. This is the left ovary. Rule out ovarian nature, ovarian origin.
Yeah, because
You
I
see
can
any
see
normal ovary?
follicles. I can see follicles around this
Good.
on the
Where
right
is the
side.
other ovary? Very good. Where is that?
Uh,
Yes.
this
Very
one.
good.
Yes, this one.
So this structure arising from,
From the right ovary, I think.
we have a very good sign here. Compare the ovarian stroma in both ovaries?
Yeah, this a signal. I mean, it's
Around the follicles. What about the stroma around the follicles? High or low signal?
a low signal.
Very low signal. What about the normal left ovary?
It is showing high signal.
Any high to
high and
intermediate, so it's accepted.
intermediate to high. Yes.
Yes. Very good. Very good. So what do you expect happened in the right ovary?
It is enlarged and with low signal peripherally could represent a chronic process, or it could represent I mean it has undergone somewhat ischemia.
You determine the nature of the ovarian lesion? What is this?
This could represent ovarian dermoid.
How to confirm from a single sequence?
Yeah, we have to fat set sequences for confirmation.
Okay, I'll give you fat set. Just give me the mouse and where first this T1 and oh no, and this is T2. Why not coming here? Okay. Yes, a T1 and T2. Okay. You see the difference? It's high signal intensity on T1, which may be fat, maybe what?
Maybe hemorrhage.
Maybe hemorrhage, okay?
Yes.
But low signal intensity structure, we need fat set.
Yes, I need
This is fat set post contrast.
Yeah, so it confirms a fatty component anteriorly.
Good.
Fat fluid level. This is confirms the ovarian dermoid.
Very good. And let's return to. Yes, it's definitely dermoid. This is number one.
Yes.
Number two, it's enhanced study. Let's see the normal left ovary. Normal enhancement. Okay, so normal stroma, normal enhancement of the left ovary. What about the right ovarian
Left ovary
stroma?
is, it's a low signal and it's not showing any
No
significant
enhancement at all. You see, no enhancement at all. And very low signal on T2, it's a chronic. It's hemorrhagic infarctions in this area. And usually, again, my friends, if we have a huge lesion like this, usually the stroma will be very thin. I cannot see a significant amount of residual stroma. Actually, this is some sort of a edematous stroma with hemorrhage inside. So this is a chronic case, usually of torsed ovary containing a dermoid cyst. Okay.
Yes.
And also, by the way, let's see T1 again. T1 pre-contrast, T1 pre, yes. This is a dermoid. What about the small cystic structure in the normal ovary? High signal. You see? It's also abnormal. This is not a dominant follicle. It's a high signal. And high signal
we have to look at the fat set as well. It could represent another dermoid in the left ovary.
Another dermoid. Very good. You see, for this reason, I told you it's a good long case. We have too many findings. This is the urgent finding, but we have also another smaller dermoid.
Yes.
Very good, my friend. Very good. So we covered till now. Thank you, my friend. Ovarian torsion, whether the ovary is torsed alone, which is common in pediatric age group, or ovary torsed containing cyst or mass. And this is common for long case. Okay.